New calls this morning for Health and Human Services Secretary Robert Kennedy Jr. to step down, and this time is coming from inside his own department. More than 1,000 former and current HHS employees have released a letter demanding his resignation. They say his leadership has, quote, put the health of all Americans at risk. CNN medical correspondent Meg Terrell is here to explain what's in this letter.
Yeah, so they cite a few things here in saying that the secretary is endangering the nation's health. One is, of course, the facilitation of the firing of the CDC director last week, which prompted the resignations of several key longtime CDC leaders. They also cite what they call the appointment of political ideologues to positions advising the CDC on vaccines and also within HHS doing work on vaccine research, as well as rescinding the emergency use authorizations of COVID-19 vaccines without, they say, providing sufficient data or explanation of their methods. And so in this letter, which some of them signed anonymously for fear of reprisals, and they also emphasize they're doing in their own personal capacities, they are saying if the secretary declines to resign, they're asking the president and Congress to replace him. Of course, this follows calls from some members of Congress, including Senator Patty Murray, Senator Bernie Sanders, Representative Rosa DeLauro, for him to resign or be fired. Of course, those are Democrats and independents. We're not hearing the same from Republicans. We did hear from Senator Bill Cassidy that he's calling for more oversight of especially the CDC Advisory Committee, but certainly not going as far as his Democratic colleagues.
No, Senator Cassidy's words so far have been very carefully chosen. We'll see if that continues this week. I know Secretary Kennedy will be up on Capitol Hill for testimony.
Tomorrow.
All right, Meg Terrell, thank you very much.
Thank you.
Kate?
In another move at HHS and what could be viewed as another push for a purge, Dr. Paul Offit, a doctor you've seen very often on this show, has now been blocked from participating in a critical FDA Vaccine Advisory Committee, a committee he has long been a member of. This is a committee made up of independent experts who advise the FDA on vaccine, are very important voices on what vaccines we have available to us all across the country. HHS says, according to a spokesperson about this, that the FDA issued notifications to certain advisory committee members whose special government employee terms have expired and therefore can no longer participate in advisory work. This does, though, raise real questions about what medical experts are being pushed out and what ideologues are being brought in throughout the agency. Joining me right now is Dr. Paul Offit, the director of the Vaccine Education Center at the Children's Hospital, Philadelphia. Doctor, you had been asked previously by a senior FDA official to extend your term on this panel. What's your understanding then of what changed?
I don't know. I know that I was asked to extend for 4 years. I agreed to extend for 2 more years through 2027. I was then asked to fill out these special government employee forms, which I did, which were supposed to be pro forma. They went through FDA, went to HHS, and then for whatever reason, HHS, Health and Human Services, held it up. So therefore, I'm not going to be on the committee. I was never formally told that. I just was told that it was held up and that I'm now should consider myself to not be on the committee anymore.
Anyone who's watched our conversations for many months now know that you have been speaking out against RFK Jr.'s resistance to science and his conspiracy theories for years. Do you think this is because you spoke out against him? Do you think this is personal rather than having anything to do with the trend of even him clearing out experts and replacing them with people who support his vaccine cynicism?
Well, I know that I've been critical of Robert F. Kennedy Jr. for years for good reason, and I know that this was not being held up by the FDA. Rather, it's being held up at the level of Health and Human Services. Those two things are true. Whether they're causally related, I don't know. If that is true, that I was specifically targeted, that's pretty petty, I think, on the part of HHS.
Will you trust the advice coming from this critical advisory panel now and going forward?
Yes, absolutely. The people who are still on that committee, like Eric Rubin or Arnold Monto or Hank Bernstein or Haley Gans or Stanley Perlman. The men and women who are currently on that committee are brilliant and excellent. And I don't think my not being on that committee in no way negatively impacts that committee. Personally, I would love to still be on it because I really enjoyed the conversations that we had, lively conversations as we reviewed the data. But I think the American public should be reassured that the data or the advice that they're going to be getting from that committee will be excellent.
Which is important to hear, because at the same time, as Meg Terrell was just talking about, you have this now more than 1,000 employees, current and former of HHS, speaking out and calling for RFK Jr. to resign, saying that he's endangering America's health. What do you think? Do you think a group like that speaking out will have an impact? Or maybe my better question would be, would it have an impact in another political environment?
I don't. I mean, I think you've had so many medical and scientific professional societies stepping forward. You've had a letter by 75 Nobel Prize winners. You've had a letter by 17,000 clinicians. I think that the only way that RFK Jr. steps down is if Donald Trump asks him to step down. I think that that Robert F. Kennedy Jr. realizes that he's going to have a meeting on Thursday in front of the Finance Committee to answer questions in front of them. And I think nothing will happen, because I think Robert F. Kennedy Jr. learned very early on that he can act without government oversight. Given how many outrageous things he's already done and gotten away with, I think he's learned that as long as Donald Trump is on his side, he's fine.
I wanted to ask you, because Kennedy Jr. himself is now speaking out, responding and pushing back on another group that spoke out, which is a group of former CDC directors speaking out against his leadership. They said, and we had Richard Besser on who said this, that he's endangering Americans' health. Kennedy put out his own op-ed saying this: the American people no longer believe the CDC has their best interests at heart, and defends his actions since coming in as this: we have shown what a focused CDC can achieve. When measles flared this year in Texas, we brought vaccines, therapeutics, and resources to the epicenter. The outbreak ended quickly, proving the CDC can act swiftly with precision when guided by science and freed from ideology. That response was neither pro-vax nor anti-vax. But Dr. Offit, this group of former CDC directors, they actually describe the actual reality of what happened with this outbreak as one of RFK's failings, saying that, and you and I talked about this, he focused on unproven treatments while downplaying vaccines. What is he laying out here then?
That's right. So what happened? What happened was there was the beginning of an outbreak in West Texas, and it was overwhelming. And so people on the ground, people who work for the Texas Department of Health, asked the CDC to please come help them. And the CDC didn't really respond because they'd been shredded by Robert F. Kennedy Jr. in terms of personnel, in terms of being able to do surveillance, in terms of being able to set up immunization clinics. There were 21 immunization clinics that were set up to come out of Dallas to help in these high-risk areas, and they were canceled for lack of funding. And so what did Robert F. Kennedy Jr.? He said, just take vitamin A. Nutrition is the best defense. And so people took vitamin A, and then they took more vitamin A, and then they took more vitamin A. And what ended up happening is children got admitted to the hospital with severe liver damage due to vitamin A excess. And this is Robert F. Kennedy Jr. He similarly went on national television around that time and said measles vaccine kills people every year, which isn't true, that measles vaccine causes blindness and deafness, which isn't true. You could not have found a worse person to be in charge of Health and Human Services during this measles outbreak than him. And the only reason that it ended was summer, because this is generally a winter and spring disease. We experienced that in Philadelphia in 1990, 1991, when we had 1,400 cases of measles and 9 deaths. What ended that epidemic was summer. And I fully suspect that as we go back to school again and we enter winter, you're going to see measles once again flare up, because Robert F. Kennedy Jr. has consistently decried the harms falsely of that vaccine and said all you need is nutrition.
Well, we're going to need your expertise and advice on an advisory panel or not throughout all of this. Dr. Paul Offit, thank you for your time.